My first participant, Dr. Bharat of DAKSHAs.
We are a social enterprise with a vision of delivering universal access to safe surgery so that people who cannot afford surgery can undergo it. How we do it is we have identified that there are a lot of resources in our system which already exist that we are unable to utilize properly. So we act as a health aggregator. We bring underutilized hospitals, free surgery time, we bring in charitable clinics into our loop so that our cost of healthcare delivery comes down. At DAKSHAs we also plug gaps. What we do is we identify all these elements in the system, we identify what's missing in them, and then we provide it from our side. The 2011-12 statistics shows that 55 million Indians became poor because of hospital bills. So this is a challenge that we have taken up. We have decided to deliver orthopedic surgery at zero. So the challenge is, can we deliver orthopedic surgery at zero price without charging the patient anything? And we've seen over the last 18 months that this is possible and we are breaking even. So this was a pilot project that we did. So our current status is we run a pilot clinic which is a charitable clinic with an NGO. It's a pain clinic where 8 specialists see each patient. The patient is charged only 40 rupees. The tests are charged 25% of the current market rate, and we approach pain from a multi-modality manner, deal with it at all its levels. 95% of our patients are cured without surgery, and hardly the 3 to 5% who actually need surgery undergo it with support of state insurance like Arogyasri. We also discovered a surprising fact. We found that India is very generous, and we have discovered what we call as the human funnel. We have seen that the number of people who have left behind have an equal number of philanthropists who are willing to help them, and many more resources that are available free in our system. So we pass all these 3 elements through a funnel, and we are able to deliver surgery in a sustainable and we believe in a scalable manner.
ఎవరు మీ నుంచి బెనిఫిట్ అవుతారు అంటే నాకు తెలిసిన వాళ్ళకి ఎవరికో నిన్న ఈమెయిల్ పంపించారు నాకు ఏదో సమ్ సర్జరీ కావాలి రెయిన్బో హాస్పిటల్లో అని దే డోంట్ హ్యావ్ మనీ వాళ్ళ దగ్గర డబ్బులు లేవు సో మేము హౌ కెన్ వి రీచ్ యూ విల్ యూ హెల్ప్ us in that situation?
We deal with the patient directly, so we don't deal with patients who are already in a hospital system. Our patients come directly to us in the clinic, and our target.
So you are a clinic?
We don't own any infrastructure. We tie up with existing infrastructure because we want to be a lean organization, and we believe there is enough infrastructure that we can utilize.
ఆ పార్ట్ అర్థమైంది నాకు. ఎవరన్నా నీడ్ లో ఉన్నాళ్ళు మీరు ఉన్నారని ఎట్లా తెలుస్తుంది? ఇప్పుడు సపోజ్ ఎవరికైనా జ్వరం వచ్చింది, ఏదో ప్రాబ్లం వచ్చింది, ఇమీడియట్ ఇన్స్టింక్ట్ హాస్పిటల్కి వెళ్తాం, అది గవర్నమెంట్ హాస్పిటల్ లేకపోతే ప్రైవేట్ హాస్పిటల్. మీ దగ్గరికి రావాలని ఇన్స్టింక్ట్ పనిచేయదు కదా, మీరు ఉన్నారు అని ఎట్లా తెలుస్తుంది?
So because we are a lean organization, we don't want to reinvent any wheels. So we have not spent on brand building. There are already a lot of organizations which have built credibility, who are embedded in the community and also in terms of health. So we partner with such organizations, offer our service in their setups.
ఇందాక నేను అన్నాను కదా, సే ఫర్ ఎగ్జాంపుల్ రెయిన్బో హాస్పిటల్ లాంటి హాస్పిటల్లో ఎవరో చేరిన తర్వాత తెలిసింది సర్జరీ కావాలని, కానీ వాళ్ళ దగ్గర డబ్బు లేదు, వాళ్ళకి ఎలా హెల్ప్ చేయగలరు మీరు?
Right now in our project we have not tried to reach out. We are mostly working with our network partners. So because we wanted to test this model and see its feasibility.
Okay.
So, but from what we have seen, I think it is possible to partner with the NGO and the charitable clinics in the city and their rural outreach programs and reach out significant population. I do not believe we need an independent activity for that.
How do you evaluate the healthcare providers? What is the system that you use?
No, we provide an end-to-end solution. We starting from seeing the patient in the clinic to doing the surgery to taking care of the patient after the surgery. We deliver all this service.
Right now, my utilization rate anta?
We see around 480 patients free of charge per month, and we do approximately 20 to 24 surgeries
a month. And a kind of surgeries even?
Most of them are orthopedic surgeries. Okay. A majority are keyhole surgeries.
Okay.
Minimally invasive joint surgeries.
Okay.
And those surgeries are delivered at the lowest cost?
Yes, and most of them are delivered with the state insurance like Arogyasri.
Suppose నేను philanthropist, నేను ఎవరైనా హెల్ప్ చేద్దాం అనుకుంటున్నాను, మీ ద్వారా హెల్ప్ చేద్దాం అనుకుంటున్నాను, how do I get in touch with you, or how do you get in touch with me?
We've seen that in a NGO clinic the population moves both ways. There are people who are poor, who can't afford, so they come to us. But there are people who are associated with that philanthropic organization who also access services with us. So you have a lot of philanthropists who come to these charitable clinics for their other purposes, but they believe in the clinic service that is being delivered there. So often they then join us as donors.
And how to get in touch with you?
We have a website, dakshas.in.
And what is your revenue model? And what will be your input cost?
The input cost, sir, is threefold. One is the physician who will run the clinic. Two is the equipment for surgery, which is around 16 to 20 lakhs for each center. And that center can do up to 40 surgeries a week. And three will be a possible technology platform that will address the issues Madam raised earlier. Help us reach out to people, help us reach out to surgery providers. So these will be our three costs that we will incur when we scale up. If I want to deliver a lead service, then I don't want to incur an extra cost to market myself. I am not interested in establishing Dakshas as a brand. I want to partner with NGOs and charities who already run health services and offer my service through them. And they reach out to a significant population.
What has been your experience with Arogyasri?
There is of course a delay, maybe 4 months to 6 months for the money to come back, but it does come back. It's not that we are not paid.
Arogyasri only works for poorer people, not for rich people.
No, so we are interested in people who cannot afford surgery.
So if somebody in middle class, somebody wants without Arogyasri, how you?
Our service design currently doesn't support this population because they have different requirements. But going forward, that's an option for us. If we want to develop a commercial venture, then we can take learnings from here and then develop a separate service design to reach out to the better economic classes.
See, most of these healthcare providers, the hospitals, where the operation theatres are available, they do not function with 100% utilization.
Correct.
So
exactly.
Are you looking at getting some auctioning those time slots from these hospitals?
We are not auctioning the slot as such, but this is what we are talking about. There is a lot of underutilization, and with the corporatization of all sectors, the previous establishments, which would say charitable hospital, trust hospitals, are even further underutilized, but they are available at a very low cost.
Okay.
So when we get a patient, we have access to such low cost providers.
So ante meeru ippudu ekkadunnaru,
Right.
ante where are you geographically located? ఈ geography-ni expand cheyadaniki etla దీన్ని మారుమూల గ్రామాలకు తీసుకెళ్తానికి కూడా ఏదైనా అవకాశం ఉందా?
Right now we have finished our pilot project in which we have established one pain clinic and we are connected to 2 charitable hospitals and 1 community hospital.
Okay.
Next week we are starting our second pain clinic center, and we see that over the next 2 years we should be able to have 5 such centers to serve the urban poor in Hyderabad. Rural healthcare has its own challenges. The problem with rural healthcare is that there has to be some person 24/7 in the village to first deal with their smaller healthcare issues.
Yes.
So the literature is available, the processes are available, and very recently the technology has also become available. We've recently acquired 3 such units. But that is a problem we want to tackle later on. The third phase of expansion would be franchising this
Model.
Yes, as a way of working, which other surgeons, hospitals or healthcare units could get into. So what we are not looking at is competition. We are looking at how to transform competitive healthcare into collaborative healthcare.
Startup Junction lo ippudu oka chinna break.